Hi, my name is Meredith Bitito. For my A&P issues topic, I chose substance abuse. The PICO question that I formed was, in patients with substance use disorder, how does the addition of psychological treatment methods such as cognitive behavioral therapy, or CBT, compared to usual treatment, affect the proportion of substance use reported within 6 months of implementation? Substance use disorder is a mental health disorder that can result in the uncontrollable use or misuse of problematic or illegal substances, such as alcohol, marijuana, illicit drugs, and prescription medications. Substance use disorder is an increasingly prevalent public health concern that can cause severe health issues and even lead to death. According to the 2019 National Survey on Drug Use and Health, approximately 7.7% of the United States individuals aged 18 or older had a substance use disorder within the past year. Combined behavioral and pharmacological interventions are considered best practice for addiction. Cognitive behavioral therapy is a first-line intervention, yet the superiority of it compared with other behavioral treatments when combined with pharmacotherapy remains unclear. An understanding of the effects of combined CBT and pharmacotherapy will inform best practice guidelines for treatment of substance use disorder. The theoretical framework that I chose to support this intervention is the quality caring model by Joanne Duffy. This theory highlights the impact that a caring relationship can have on improving patient health outcomes, the health of providers, and the healthcare systems. This model views caring as a dynamic process that nurses can engage in to facilitate a positive and supportive environment for patients and families. This theory is especially prevalent when it comes to treating patients with substance use disorder. These patients often face increased barriers to treatment due to the stigma surrounding substance abuse. The quality caring model provides a framework for nurses to help establish more quality, patient-centered caring relationships in order to foster improved health outcomes. Patients seeking treatment for substance use disorder or receiving treatment for other health concerns while suffering from substance use disorder deserve to be met with empathy from healthcare providers. The implementation plan for this intervention includes several steps and is a multidisciplinary approach. The first step is identification of participants through risk assessment and screening tools such as the ACQ, DC, the DASS, the TAPS, the CAGE, or the CRAFT survey, also through urinalysis or self-report. The first step can be completed by any healthcare provider that treats the patient, including their primary care provider or emergency medicine provider. Step 2 is the assessment of the patient's willingness to receive treatment and motivation to quit. This step is critical to success in patients with substance use disorder to determine their own personal beliefs of the illness in order to maximize the effects of any treatment. The third step is to determine the patient's accessibility to treatment, including geographic proximity, availability of transportation, and financial status, including their level of insurance and the cost of treatment. The fifth step is a referral to a licensed CBT therapist for initiation of treatment where the patient can receive care in whatever form is most effective for them, whether it be inpatient, virtual, hybrid, or through group therapy. The final step that is ongoing throughout the remainder of treatment is continued support and medical care by a provider, as well as the involvement of the patient's support system, such as their family and friends. The timeline of this intervention is 6 months. Effects of CBT typically take weeks to months to see, but patients will be assessed biweekly throughout the intervention period to ensure adequate medical treatment of withdrawal symptoms and to check progress to ensure their safety and well-being. For outcome measurements, reassessment during and after the 6-month CBT treatment using the same screening tools, urinalysis, and patient self-report. We want to see marked improvement from the previous or initial assessment and complete cessation of substance use. The findings from the 3 studies included in my initial research support the implementation of CBT for patients with substance use disorder. CBT is proven to be an effective treatment option for patients both in combination with usual pharmacotherapy and as a monotherapy. CBT is a form of psychotherapy that is adaptive for each individual's needs, making it a versatile treatment option with the applicability for multiple patient scenarios. This treatment is also widely available and relatively cost-effective, making it a more accessible option for substance use disorder patients who often experience significant barriers to treatment. By using the principles of CBT, APNs may be able to help patients identify negative thought patterns that lead to substance use and develop healthier alternative coping mechanisms. Substance use disorder presents a complex and persistent challenge in healthcare, requiring a multifaceted, evidence-based approach to care to improve patient outcomes.